is a generalist who works with a physician to help them see as many patients as they can and with as high quality as they possibly can. So after being trained in 2 years of the generals of medicine, so how to interview individuals, how to do basic procedures, how to take a history, they can work in a variety of different fields to speed up the access that people have to care and improve the quality of care.
Physician's assistants are able to work in a variety of different specialties. For example, in orthopedic surgery, in family medicine, in emergency medicine. Physician assistants really do have a very wide scope of practice and are able to work in a variety of different conditions.
So in the Physician Assistant Education Program at McMaster, it is a 2-year program. So the first year is all in-class work, so in our tutorial work, learning basic clinical skills, that kind of thing. And now the second year is all clerkship. So that's where we have placements in each designated specialty that we could be working in, and that's where we really get the good hands-on experience working with different healthcare professionals and developing our skills as future PAs.
So I chose to be a PA because I've always been interested in science, and I did a few years of research. But after that research, I decided that I wanted to have a more hands-on applied aspect of medicine and science. And so I decided to do the PA role because I wanted to get involved in care with patients.
So I really like with the PA role that you have some sort of collaborative aspects where you're working in sort of a team-based environment, but that you also have the chance to practice medicine in an independent fashion and work on your own.
So I personally chose the PA program because of the opportunity that it will provide, as it is a very up-and-coming profession in Canada. So there's a very broad range of the scope of practice that we're able to perform in each of our specialties. So I think it is a very promising career for us.
I think what's really cool about the PA program is that we all come from a variety of different backgrounds, so it makes it really unique when we're in tutorial together. As well, it's really small and really close-knit, so it's great just to get to know each other and do really fun things after class, such as bowling or escape rooms.
My favorite thing about the program is it's really interesting to learn about all these different diseases and like different health conditions, and we do that all in our tutorials, but then you're also learning the practical skills about how you'd assess for these different illnesses in people.
My favorite thing about the program would probably be how relevant all of the classes are that we're taking to each other. So even though we have separate classes for tutorial, communications, and clinical skills, all of them really have the same goal and focus around the same concepts. So it's really useful to know that we can take things from all of those different classes and bring them forward into clinical.
So I really like the fast-paced nature of the program. You're always doing work, you're always learning, and you're really immersed in sort of a fast-paced environment that you're going to be thrown into when you start to work as a PA.
So something that's really nice and really unique to the Physician Assistant program is that because we are such a small program, we really have this supportive environment where everyone comes from different undergraduate backgrounds and everyone brings a different perspective to the table.
I really like that within the PA program there's a great sense of community. It's all about everyone helping everyone, and you just want your classmates to do as well as you do.
Something that's really nice about the program is since we're so tight-knit, there's definitely a really good feeling of teamwork between students. There's no competition really, so it's nice that when we're preparing for something, we can all kind of like set time aside and work together because each of us wants each other to do well. We want our profession to grow, and we want to make sure that every one of us that's going out into a clinical setting is representing each other well. So in order to do that, we really work hard together and try to grow as a group instead of as individuals.
So a typical week in the PA program involves going to your PBL classes, which usually fall on a Monday and a Thursday. So this is about 3 hours in the afternoon where you come and you sit with your classmates and talk about the case that's been presented to you. You ask questions and follow up on those questions throughout the week.
It works as a discussion where together with your peers in the tutorial group, you offer information, you ask questions of each other, and together as a group you stimulate each other's learning in order to solve the case.
And everyone kind of teaches everyone, which is nice because we get different opinions and everyone has different experiences, so there's a lot to learn from everyone.
And it's very helpful when you come from a specific background. If you may not be familiar with a certain topic and have some difficulty understanding it, the benefit of PBL is that there's a peer in your group that understands that and is able to explain it to you, and then when it comes time for something that you feel very comfortable with, you're able to explain it back to them.
And then on Tuesdays, we'll have our clinical skills class. So that's where we're learning to listen to different heart sounds or looking for vital signs, taking blood pressures, different things like that.
It does a lot of the clinical approach to what a PA does, and on a monthly basis we get stimulated patients, or SPs, and they kind of give a reality approach to how you would interact with the patient in a clinical environment. So it's great for that practice, as well as to get feedback from your preceptors to where you stand and how you can improve in the future, because we're all really new at this, so we can always be improving.
Wednesdays we'll often have communications class where we learn how we would talk to patients in a physician-patient encounter.
So learning how to give bad news to patients, for example, dealing with more difficult situations, mental health, sexual health, that kind of thing. So that'll really prepare us to be good healthcare practitioners and be really empathetic with our patients throughout our career.
And then we might also have our professional competencies class where they teach us about some of the things that are important as a PA involved with the health system.
In addition to that, you spend a lot of time setting up your own clinical placements where you learn the more practical side of it and actually synthesizing all the things you've been learning in class and doing it in a professional setting.
So the anatomy lab is actually a really cool aspect of the program because we have free access to there. So we can go in there whenever we want, and they have real specimens. So that's great because rather than just looking at a textbook, you're looking at the real thing. So you can see hearts, you can see lungs, you can see different limbs and muscles, and it's a really good experience just to know what you'll be looking for in real life.
Ways you can get involved in the physician assistant program is the Student Association, MPASA. So there's a group of about 11 or 12 of us that get together sometimes week to week, sometimes bi-weekly, and we try to organize different things for the program. So we try to promote advocacy for the physician assistant program and the profession. We do some community outreach, and we definitely try to organize things so we as a program can get closer together and kind of take some time to have fun outside of all the hard work that we do in the class.
Student Council does a lot of outreach programs such as trick-or-treating at McMaster Children's Hospital, and we're looking to do some soup kitchens as well in the future.
We've started some intramural teams, so right now, for example, I'm playing basketball. We're going to play volleyball in the winter, which is awesome because it gets a bit of a social aspect to the program too.
There's lots of different clubs at MAC to get involved in with regards to different hobbies and cultural interests.
And I think it's really great for a bonding perspective and as well as a mental health break during our studies.